Think you call this the collapse of health care reform, but you see this now, united Republican opposition, the president's poll numbers at new lows, and a lot of leading Democrats believe that if this bill goes down, it will cripple the Obama presidency. Are you prepared to do that?
Of course not. But that's one of the problems is we've gotten to this stage, George, and you know this better than most, in Washington, where passing any bill is a victory. And that's the problem. Decisions are being made about the long-term future of this country for short-term political reasons, and that's never a good sign. There are some good things in this bill. The problem is we are now committed to a solution using the private insurance companies, and you will be forced to buy insurance. If you don't, you'll pay a fine, and 27% of the money that you put in will not go to your health care. It'll go to CEOs who make $20 million a year. This is a bigger bailout for the insurance industry than AIG, and not one person, a very small number of people are going to get any insurance at all until 2014, if the bill works.
Well, excuse me, the president says that this is going to cover about 30 million Americans, and a lot of your fellow progressives and liberals are on board. Listen to Senator Tom Harkin.
I plead with all of my progressive friends, now is the time to get over this hurdle. If this bill, Rachel, were so bad, why are 40 Republicans on the Hill going after it day after day after day and trying to kill it?
You say this is a big bailout for the insurance companies, but you saw Senator Harkin is for it. Other liberals like Senator Sherrod Brown, Jay Rockefeller are for it. Are you saying they're all selling out?
No, of course I'm not saying they're selling out. These are wonderful people, and as I said, there are some good things in the bill. But the problem is there has to be a line beyond which you think the bill's bad for the country. I think at this point, the bill does more harm than good. I don't believe there's going to be the money around in 5 years because the insurance companies are charging so much. The pre-existing conditions piece, which is disappeared essentially, because you can this fine print in this bill allows the insurance companies to charge you 3 times as much if you're older than they do if you're younger. This is an insurance company's dream, this bill, and I think it's gone too far. It's just it's a shame, but bad decisions were made along the way, and now we're in the last week of this, and this is the Washington scramble, and I think it's ill-advised.
Except that, as you say, you know, if you look at the fine print of the bill, older Americans are going to pay more, but the American Association for Retired People supports the bill. The president has pointed out that it does cover 30 million Americans. It does have a patient's bill of rights for those who have insurance, and it begins to control costs. Look at what it's doing to control health care costs. A tax on these health care, Cadillac health insurance plans, new incentives for doctors and hospitals to focus on quality, and new Medicare panels to try to get these costs under control. You've said time and time again that that is the key to health care reform, controlling costs. The president says this bill does it.
George, I don't see, you just named a whole bunch of bureaucracies and a lot of promises. I don't see any health care control, very little cost control in this bill at all. I really don't. Look, I want health care reform, but the choices have been taken away from the American people. The special interests basically made a lot of demands on the people who are passing this bill, and everybody has to decide for themselves. I think Jay Rockefeller and Tom Harkin and Dick Durbin are fantastic human beings. I really think they're wonderful, wonderful people. But in Washington, you get into this crunch where good money gets thrown after, or bad money, good money gets thrown after bad, and good policy gets thrown after bad policy. And at this point, I think this bill is not worth passing in its present form. There's a lot of different things you could do. One of the things you could do is take some of the things in this bill, community health center money, wellness and prevention money, the exchanges, which are a good way of, which was done in Massachusetts to help people buy health insurance. But the fundamental part of this bill that has been decided is that we will only do health insurance through the private sector for the future, and you will not have a choice as an American to get into other kinds of systems which work better. And I think that's a mistake, and it always happens in the last week where people go too far, water down things too much, give too much to the special interests, and that's where we are with this bill today.
Final question. Any chance you can succeed here? Can you convince your fellow Vermonter, Senator Bernie Sanders, to vote no?
Well, I honestly think this thing's probably going to pass the Senate and go over to the House. The problem is there's not a lot of room to fix it in the House because the 4 senators who balked on this, who basically represent the insurance industry, are not going to support the conference committee when it comes back either. So, you know, my job is not to convince senators. My job is to say what I think is right. And I've been involved in this all along. I've put up with a lot of stuff that I didn't like because I thought at the end of the day what was good about the bill outweighed what's bad about the bill. I don't believe that anymore.